Well, good morning to you and welcome to another edition of Expert Alert here on WLOX. I'm Jim Tabor, your host, and today we're going to delve into the medical field with Integrated Medical on Pass Road in Gulfport. And joining me is Office Manager Sunny Elmer.
Hi.
And also Brandy Parker, who's family nurse practitioner. Good to have you on the show this morning.
Thank you.
And I know this has probably been a very busy year for you.
Yes.
So before we get into some of the different things, tell us about Integrated Medical and some background about it, if you would.
Integrated Medical and Wellness is a traditional family practice. We specialize in wellness. We do general office visits, hormone pellet insertions, diet services, posture checks, allergy testing. We also do injections for osteoarthritis of the knee joint.
Mm-hmm. Now, as a family medicine, I guess people with colds or whatever,
Coughs, colds,
flu,
COVID.
COVID. Now that's the big thing right now. Of course, is getting tested for COVID if they have symptoms that could lead up to it, like running a high fever, cough. I guess loss of taste or smell.
Right, loss
I've
of
heard of
taste
that one
and
too.
smell.
Is a big one, and you do the different tests there.
We do. We do a 15-minute rapid test, which is a finger prick, and then we do a antibody test, which is a blood draw, and we also do the nasal swab.
Okay. Now, back earlier this month, my wife and I just got back from a visit to Jamaica. We came to y'all that Monday morning to be tested and everything, so we could return to work as a requirement. She, of course, tested negative, and I tested negative, but I had the antibodies, which basically at some point I've had it and never even knew about it.
Didn't know.
And which is, I guess, a good thing that my system fought it off.
Right.
Even us old guys have some birdies. So let's talk a little bit about hormone therapy. We talked about this before we came on the air, and what it does, what you do for that, and what it's for. So what kind of clientele do you see for hormone therapy?
So we can see anybody within the range of 20 to postmenopausal, older patients, men and women both. Men are a little bit, more scared to say they have hormone deficiencies, but they do as well. It treats if you have trouble sleeping, just regulate your hormones. If you suffer from any type of depression or anxiety, it does help with weight loss. It's not, it's not
solely for
weight loss, but it does help because once your hormones are in check, it does help with the weight loss.
Libido?
It does help with libido as well. Just overall makes you feel better.
Now, how does it work as far as, what is it, an injection or something you take orally or what?
So it's a pellet insertion. So the pellets are actually inserted into the soft tissue. Brandy, our nurse practitioner here, she's actually a certified BioT physician. So she inserts the pellets into the soft tissue, which is a lot different than your synthetic medications such as your pills or your creams. So your body absorbs the pellets readily over your synthetic medications.
Yeah, it's kind of like, what's the birth control things that they could insert into you? The implants. I guess it's like that. And it just slowly dissolves over a period of time. How long does it last?
For women, it's about 3 to 4 months. For men, about 4 to 5, depending on your activity levels. The more active you are, you can see more of like a 3-month with women and a 4-month with men because it is dissolved by your cardiac output.
Okay.
So it, you could see it about 3-4 months.
Okay. Diet services. Mississippi, I hate to say, we're the worst when it comes to being when it comes to obesity, and here we are getting into the holiday season when everybody loves to eat, Thanksgiving and all that. Talk about the different diet services that you provide there at Integrated.
Well, we do general nutrition recommendations with weight loss challenges, monthly weight loss tracking. We can do weight loss medications for patients who might be interested in weight loss medications, appetite suppressants, and we also offer weekly private nutritional counseling sessions. Okay,
so basically you've got dietary things that they can follow to eat proper, because that's one of the things we've gotten in today's world. We just don't eat as good as we used to. We just grab something fast and it may not be nutritional enough, and Processed foods, I know, are probably the worst things that we can deal with.
Yes.
So now this was something when I got your outline, posture checks. Now, Sonny, this is something that you've got a gentleman there that does posture checks. Tell me about that.
So his name is Anthony Anderson. We brought him on about a week ago. We figured that would help out a lot with some of our patients with the knee pain. I've actually had him do a posture check on me just to see how it worked, and basically he'll look at your basic posture by doing a couple overhead squats to see how your body is if you're bending forward or seated in a chair. And then after he does your evaluation, he goes to your pressure points and he releases. It's called a release. And he releases that pressure on those pressure points, which helps out with your posture in the long run. And he's able to kind of tell you where you're suffering with your muscle stiffness and where your posture is gone.
And I'm sure there's many people out there that are thinking, I'm young. I don't have to worry. My posture's fine. But if you're, in a job position where you're, slumped over like this all day long, on a computer or for whatever reason, you can start at an early age, which can cause some problems as you get older.
Right. Athletes too can greatly benefit from the posture checks as well.
And as I said, because down the line, improper postures could, you could end up being slumped over walking, because it's too painful to straighten up. Allergy testing. Now I know we have a lot of problems with allergies down here on the coast because our weather is like it's like up and down all the time. So what kind of different things do y'all test for?
Right now we're testing for environmental allergies such as different types of trees and grasses and different things like that, pet dander, those type things.
Okay, yeah, and I'm sure that's an issue, especially with pet, but are food allergies something that you see a lot of?
We are not doing the food allergy testing just yet, but that is something that's coming in the future.
Okay.
We are looking into doing food allergy testing.
Knee pain. Do you have a lot of people coming in with problems with knee pain, I guess?
We have a significant amount of people coming in for knee pain, and Brandy is one of our injectors, so she'll be able to fill you in a little bit
what do you do for that? For this is coming up. Mark your calendar. Coming up on December 11th, they're going to have a special offer. They're starting the Regenerative Treatment Therapy, injecting your own body's enzymes. How does that work?
So what we do is we draw blood from your arm and we spin it down and we get the platelets out of it, the platelet-rich protein out of it, and we inject that into different points on your body, in your knee or in your shoulder or in your spine. And what it does is it helps to enhance your own body's healing process.
Okay. And I guess instead of using medicine, so to speak, your own body's hormones or whatever are a lot better for your system to use it.
Correct.
And we're going to mention this. They are looking for a few patients to come in that day for the treatment, and they're going to offer a less than retail cost as a special.
It's a really
good deal
special,
on that.
yes.
Okay, and again, we're going to make that December the 11th. Should they call and make an appointment?
Yes.
Okay. So
spots are limited.
Spots are limited. You see the phone numbers on your screen right there, and where it's located. It's just west of DeBeige Road, not too far past us, to the west there. That you see the blue siding on the building called Integrated Medical. But if they want to make do they need to make an appointment for a family medicine checkup or something like that? Would it be best to do that, or do you take walk-ins?
We do take some walk-ins. We have a physician or Brandy available all day. Somebody's always at the front desk. So call-in would be the best, but we will take a walk-in as well.
And what are your hours over there, Sonny?
We can see a patient as early as 8:15 to about 4:30.
Okay, wonderful. Thank y'all so much for being on the show with us today.
Yep, thank you.
And giving us some insight on Integrated Medical. Again, numbers on your screen. December the 11th, they're looking for a few patients to come in for that special treatment that day at a very substantial special cost for you. So if you have information or you want some information on that, you can give them a call or stop by again and make an appointment, because that's going to be very limited. And welcome, thank you again for being with us this morning on our Expert Alert.
If you have a question for any of our experts, go to WLOX.com and click on Expert Alert. For a list of any of our upcoming experts, go to WLOX.com and click on Expert Alert.